Hey guys, welcome to our tutorial for our clinical information system. This is from BSN2A of San Lorenzo Ruiz College of Ormoc. So this is the first part of our clinical information system. First, we must type in the password. The only people that can access this is a sonographer, pharmacist, nurse, and as well as a physician or a doctor. Welcome to our clinical information system. Again, this is from BSN2A for our nursing informatics subject in nursing. We must click the clinical information system. After clicking, we can see a home button, add patient, and a search patient. So let's click the add patient button. So in the add patient button, you can see the surname, the first name, age, sex, and patient's file, as well as search patient. Once we search for a specific patient, we must type in the surname on all capital letters because we cannot search the surname of our patient if it's not exactly written as it was. So let's say Park, so we can see that the name Park is highlighted here at the left side of your screen. So now let us try to add a patient. So we must click the add patient button and we can see our patient record. So for the patient record, we can type in a surname, first name. For example, we will type Daigan and first name, Clysa. And then we can type the age and the sex. So after that, we can add as new. As you can see, we can click here, add new. And Daigan Clysa, age 20, sex female, is written there. Now, we also have a quick search button here on top of the screen. So the quick search button lets you type a name and then the general information of the person can be seen. As you can see, the general information of our patient Rose Ann can be seen in front of you, as well as the emergency contact and information history and everything else that is related to the patient. Now we can click the exit. So now let us go to the patient's file. So let's click Park Rose. So clicking the file, we can see the patient's profile, her name, birthday, as well as room number, and her picture as well to identify the patient's face. We can see there's a home button, back button, patient profile, patient demographics, physical assessment, history, nursing care plan, charts, nurse's notes, health teaching, doctor's order, prescription sheet, lab results, and dispensed medication. So let us move on to our patient demographics. For the patient demographics, we can see the patient information that would include the last name, first name, middle initial, suffix, age, nationality, religion, blood type, date of birth, field of health number, gender, the status, and marital status, the contact information, as well as and so on, the physical referral information, the primary care physician, the referring physician, and the responsible party information, which is what we call our guardians, the person we go to in case of anything happens. If anything happens, rather. Next would be the physical assessment. So once we click physical assessment, we can see that there is a body part, a specific body part, inspection, palpation, percussion, and auscultation. So, for example, we inspect the hair, we palpate the scalp, percuss, and auscultate the specific parts of the certain body part written at the left side. Next is our history. So in the history, we can see the presenting complaints in chronological order and patient's language. In the right and the left side, we can see complaint in patient's language. And at the left side, the duration, since how many days or weeks or months or years the patient has been experiencing this. Next is the history of presenting complaints or history of presenting illness. Next is the history of past illness, the treatment history, the family health history, occupational history, current and previous, dietary history, personal history, menstrual history for females, obstetric history in females, and cardiovascular system, respiratory system, gastrointestinal system, genitourinary system, nervous system, musculoskeletal system, as well as the endocrine system. Next would be the nursing care plan. For the nursing care plan, we always have the assessment, nursing diagnosis, patient goal, intervention, as well as the evaluation. As you can see in front of you, we have two plans. This is because that we are not really sure that what we've assessed or properly diagnosed of the patient is actually the first plan is going to work. So we have a second plan to ensure that if the first plan doesn't work, we have a plan number two. Next would be the charts. So for the charts, we decided to put it on a word. So once we click the patient chart, we can see the patient's chart. So an example of this would be the 24-hour patient assessment and care record. So you just open the patient chart and you can see this as well as the other charts as well. Okay, going back, we have the nurse's notes. So for the nurse's notes, these are the notes of the nurse of how the patient had done the entire day. So for example, where was the patient admitted, when was he received, when was what type of medication, what time, and the specifics. Next would be the health teaching. So for the health teaching, we can see the objectives, content, methodology, and evaluation. Again, we have a plan number one and a plan number two. In case the plan number one doesn't work, we must always be ready for anything else. Next would be the doctor's order. For the doctor's order, these are the order of the doctor. So what time was it ordered, the date, and these are what the nurse is going to do to the patient by the order of the doctor. Next is the RX sheet or the prescription sheet. So the prescription sheet, this is what the doctor has prescribed to our patient. What medication should the patient be taking? How many days? The quantity per day? So we can see the patient's name, address, date, the prescription itself, do not refill at the bottom, and also signature to ensure that this prescription sheet was actually made by the doctor. Next would be the lab results. For the lab results, we can see the CBC, ultrasound, X-ray, CT scan, and MRI. So for the CBC, we can see the complete blood count of the blood count, blood indices, relative differential count, and absolute differential count. So for example, for the blood count, for example, the white blood cells or the reference values is 5 to 10, its unit, and then the result. So for the reference values, this is where we refer if the patient's results is within the normal range, if it is past that or lower than that. Next would be the ultrasound. So for the ultrasound, we can see the charts here for the patient name, date of exam, history, for like transabdominal, transvaginal, the comments, and who the sonographer was. That's what we see in the ultrasound. For the X-ray, this is what we can see. So we can see the X-ray, the date, the cervical, thoracic, lumbar, and other as well. Next would be the CT scan. So for the CT scan, we can see the patient's history or the past CT scans, the comparison to the present, the technique that was done, the findings, as well as the impression. The next would be the MRI. So for the MRI, we can see the patient information sheet, the history of renal disease, such as diabetes, previous surgery to area studied today. We can see the L spine MRI, the C spine MRI, brain MRI, and the extremities. And last is the dispensed medications. For the dispensed medications, we can see a prescription sheet and also this date, time, quantity, medication, nurse, and signature remarks. So this can be seen by the pharmacist, so she will know what was prescribed by the doctor. So she will take down the date, the time, the quantity, the medication, who was the nurse, and her signature remarks for the dispensation of for the dispense of the medications. After that, if you want to go back to the add profile, you click back, and when you click home, you can go back home. So everything in the clinical information system that we have shown you is all tabulated as well as encoded. So all the results, the name, the information, and everything else must be tabulated and encoded. So that is all for our clinical information system. Thank you.